I'm in shape because I run, avoid sugar, and do Ozempic.
Ozempic, right for me.
This is Ozempic. It's
weight loss.
Easy weight loss.
Miracle diet drug, miracle weight loss drug.
What are you doing?
Ugh, keep those chips out of my sight. I'm trying to get my summer bar. All these celebrities seem to have the perfect bodies and I keep seeing them all over my Instagram feed.
You know, there's gotta be a better way than this.
Oh my god, I got it. I've seen it all over the news and everybody is talking about it. Ozempic.
Whoa, no, that's not what I'm talking about. Resorting to medicine should never be the first thing you do. Before you take any medicine, you should do some research to see what this medicine does to you.
Fine, Miss Know-It-all. What is Ozempic?
Well, firstly, Ozempic is just a type of GLP-1 receptor agonist. GLP-1 receptor agonist is kind of like a big umbrella. It covers a lot of different medications. For example, exenatide, liraglutide, dulaglutide, and semaglutide. They have been approved by the FDA to treat type 2 diabetes, obesity, and most recently, chronic kidney disease.
Okay, but what does that have to do with my body?
I was getting there. You see, your small intestine produces a hormone called GLP-1, which is in charge of a ton of different things. This includes, firstly, triggering insulin release from your pancreas.
What's insulin?
Insulin helps regulate sugar in your body. It's like a key. It allows glucose to go from your bloodstream into your cells. When your body can't produce insulin, you have no way to unlock the cells. So the sugar stays in your blood, increasing your blood sugar, which leads to diabetes. Secondly, GLP-1 also blocks glucagon secretion. This is just a fancy way of saying a hormone that your body uses to raise your blood sugar.
Okay, I got it. But how is GLP-1 receptor agonist related to obesity?
Well, besides what I've already mentioned, GLP-1 also does two things. It slows digestion by decreasing the glucose or sugar released from the food you eat, and by making you feel full after eating.
Wait. It changes my appetite? How does that work?
Good question. In your brain, you have serotonin, which controls how hungry you are. It's like a slight dimmer switch. And GLP-1 can tell your brain to turn down a part of serotonin's system, so you don't feel as hungry. Then, GLP-1 slows down the stomach, so it takes longer to empty its content, and slows down your digestive system, so you feel full, even if you've eaten less than usual.
Okay, you've been telling me all these things GLP-1 does, but what about the actual medicine? The GLP-1 receptor agonist?
Well, the GLP-1 receptor agonist mimics this hormone by binding to the receptors of the GLP-1 hormone.
In human, please?
It might be easier if I show you this image.
What is that?
Let's break this down. It's kind of like charging a computer. See, your outlet hole is a receptor, your computer is the cell, and your charger is the GLP-1 hormone. When you charge GLP-1 into the receptor, it sets off a bunch of chemical reactions. Those reactions are all the things that GLP-1 does. So on your computer would start charging.
Okay, I think I got it now. So GLP-1 agonist isn't the real hormone, GLP-1, like the charger scenario. It's kind of like using a Windows charger on a Mac. It might not be made up for a Mac, but it still works. It goes into the outlet so it can still stimulate all that stuff even without GLP-1.
Yup, I find it easier to remember agonists as activators. They activate the system. For example, Ozempic is a type of medication called
semaglutide.
The semaglutide drug binds the GLP-1 receptor and boom, we've got all these amazing reactions.
Wow, this drug sounds amazing. It's like a miracle pill. Let me call the pharmacy and get it right now.
Hey, no. I did not teach you all of this to not go into the side effects.
Side effects?
Yes, side effects. Some of these include nausea, vomiting, diarrhea, dizziness, infections, headaches, mood swings, and physicians usually don't recommend you consume it if you have a family history of thyroid cancer.
Okay, I get it. But maybe I'll be lucky and won't get any of these side effects.
It doesn't matter what kind of medication, you should always be calling your doctor and asking if it is a viable option. Different people have different reactions to medicine. Something that works for your friend might not work for you.
Jeez, what was this whole talk about? I think running is easier.
Sue yourself. Remember, there's no such thing as a magical pill. To learn more about your body, interesting medical cases, and your health, subscribe, and please leave a like.